Hello and welcome. It's Framework's first ever Zoom webinar. This is a new way of communicating with you. We're trying out for the first time today. So thank you very much for taking the time to join us for our experimental pilot event. What can possibly go wrong? My name's Andy Shields. I manage the fundraising team at Framework. We're also joined today by my colleague Claire Eden, and Claire is Framework's Head of Fundraising and Communications. We're going to be with you for about 30 minutes, we think, this evening. We want to give you a picture of what's happening at Framework, how we've responded to the COVID-19 pandemic, and how we hope to engage with you, our supporters, in the year ahead. So we're going to begin with a short film. We're going to hear from our Chief Executive, Andrew Redfern.
I think the biggest challenge has been the fact that we've had to keep going. Closing down services hasn't been an option for us. The people that we work with need us. They need us all of the time, really. Some of them on a 24 hours a day basis. So of the 18,000 people who come to us for help in the course of any one year, nearly all of those people have still been needing our services during the period of the COVID epidemic. Well, in order to keep services going, we've had to do a lot of reorganisation. At one stage, around 20% of our staff were shielding in line with government guidance, so they could only work from home. They weren't able to come into work and sort of staff the rotas. There are other people working in our office locations that who we've had to ask to work from home so that we can get the social distancing in place. But the biggest issue, I think, has been in hostels and supported accommodation, where we still need to staff the rotas, but in a way that's safe for the staff and safe for the people living in those properties. So there's been a huge amount to work through. They have been absolutely fantastic in the way that they've responded. It isn't just our staff who've responded very well to this, it's our service users as well. Because I think they have realised that they need to perhaps to scale down some of their expectations of services and accept the fact that, you know, some of the things that we would have been able to do in terms of sort of, outward-looking support have not been possible. And they've really sort of helped us to get through by complying with the guidelines, not being difficult with staff when they've been bored and fed up, and also, you know, taking quite a lot of responsibility. We work with a very wide range of people. In the course of a year, we house around about 3,000 people from time to time, and they're probably the most vulnerable of the people that we work with, those that we actually house, because other landlords won't house them, at least for the time being. But there are also many people to whom we provide drug and alcohol treatment services, other forms of health intervention, employment services, support to prevent them from becoming homeless or from getting into crisis situations. So it's a very wide range of people, but they all have needs of some kind that we need to help them with. And for those people who have multiple and complex needs, you know, for instance, combinations of homelessness, mental ill health, physical ill health, substance misuse issues, they are the most vulnerable people we work with, probably about, you know, a couple of thousand at any one time. And COVID has accentuated their vulnerability, particularly those who've been sleeping rough. And there has been a central government sponsored programme called Everyone In that's brought all of those people into hotel style accommodation, and in all the areas where we work we've been supporting that process, often making the referrals, doing the assessments, working with people in the hotels, doing resettlement work. We have had support from our fantastic donors. Between them have donated around £40,000. We've had an emergency grant from the National Lottery Fund for £200,000, and that's helped to fill what we call the COVID gap. Beat the Streets, again, we've repurposed some of the money from that programme, and also Nottingham Building Society have been incredibly generous with a £30,000 grant and also an amelioration of rent on one of our properties. So great effort from many of our kind of sponsors, our individual donors, our supporters in the corporate world, really to keep the financial impact of COVID as limited as possible. There is a financial hit to Framework, but we think that it's going to be manageable. And what that's done is it's meant we could concentrate on the actual work that we needed to do to support people who otherwise would have been in very, very vulnerable situations. We had people kind of using night shelters, using hubs where they were, just literally sleeping several people in a room. That's not a safe place to be when you've got an epidemic like this circulating. So getting those people into safe environments was really important. I think the epidemic still has a long way to run, unfortunately, and we are now emerging from the lockdown, and we're beginning to see cases rising again. So the challenge has not gone away, and we will still have to keep those services going, because people are not going to be able to cope without the accommodation and the support and the healthcare that we're able to provide them with. So it's a challenge to which I think the organisation and its staff and service users have responded to wonderfully well so far, but it's an ongoing challenge. I think there'll be loads of learning that will come out of this epidemic for many organisations, and one I think bit is to reinforce what Framework's been saying for many years now, which is that we need systemic responses to the needs of individuals. People have a variety of needs. It's no use saying, oh well, we can house you, but we can't help you with your drug problem, or we can help you to get into employment. We can't help you to have enough money to get along to the interview. We need to have these joined up systemic responses. And I think the epidemic has really accentuated that, because there are many people around who would have been better able to cope with it if they'd had more joined up services in place at an earlier stage. And I think we've seen that very clearly. So one piece of learning, I think, is that we do need to join up housing and support and health and employment services much better in the future. We've been able to make more use of things like telephone support, online support, and I think we can again do more of that in the future. It's sometimes a more efficient way to help people. And I think finally the importance of quality in the physical surroundings for people, that there is space, that there is somewhere to go if you need to isolate, that that it's somewhere nice to be, not somewhere kind of depressing to be, so that if you can't go out, you can be there and it can be okay. Quality of the accommodation offer and the support offer, the importance of that actually this is a job not just worth doing but worth doing well, and that has to be resourced. And I think if the will is there from central and local government working in partnership with organisations like Framework in the future, we can respond better and more comprehensively and in a way that's more effective in terms of the outcomes, if we are prepared, if we have that commitment and that will to do it well. Framework is in a strong state. We have withstood the epidemic, at least so far, and I'm confident that we will be able to respond well to whatever more challenges emerge. So we're not here to kind of sustain our organisation. We're here to resettle and sustain our service users. And for the moment, that means that we aren't going anywhere. And so I'd like to thank our supporters for the role they play in making that possible. Our individual donors and our small charitable trusts that support us, some of the corporates that support us, are really crucial, because their money makes a difference in that we can spend it by and large on the things we need to spend it on, and that's been crucial because we've had to redirect. We've had to do things like we've had to buy PPE, for instance. We've had to procure mobile phones to enable people to keep in contact with us while they are self-isolating. We've done something we've never done before, which is buy 400 cans of super strength lager. And people say, why did we do that? Because when people are self-isolating, if they are addicted to alcohol and they can't get their hands on it, that could be life-threatening. And those are the kind of things it's really hard to kind of get a statutory funder to contribute towards. So the money that we get from individuals, because of the flexibility with which we can use it, it's always crucial, but it's been particularly crucial during the period of the pandemic. So I'd just like to thank all of our supporters. Because without you we couldn't be here. We would not have been able to survive.
Well, that was our Chief Executive, Andrew Redfern, speaking last week. But now to you, Claire. A few supporters have asked us what role volunteers have played in Framework's response to the pandemic.
Thanks, Andy, and hello to all the supporters who've joined us this evening, and thank you very much for taking time out of your very busy days to join us and find out what we've been up to. Quite early on in the pandemic, I think as early as sort of the 24th of March, when we were facing lockdown, we were told to, if you can work from home, work from home. We were also asked by the organisation to kind of galvanise our supporters and our volunteers to see what we could do to make a difference to the lives of service users and staff across the whole of the East Midlands. And we, with myself and colleagues who already work in employment and skills and within the volunteering team and at the training centre in Bulwell, we decided that we would form the volunteer response team. And very quickly we got up and running, and we advertised for volunteers to come and join our team, and we had an overwhelming response. I think within the first couple of days, 97 people had responded and filled out an online application form to come and volunteer, both as drivers for us and cooks, and as people who could help us sort food parcels. Because one of the things that we have at Framework at our training centre in Bulwell is a training kitchen where ordinarily we would help service users to gain the skills they need to live independently, and one of those skills would be cooking. So we have developed a training kitchen there, and we put that to really good use over the time of the pandemic. And with volunteer chefs, we had somebody who's a school chef, and somebody who worked at World Iberico Tapas from Nottingham, and somebody who was a teacher at Loughborough College teaching other people how to cook, came to the training centre. And we started with some deliveries from FareShare, which is a food redistribution charity. And we had those deliveries, and then we put out a call for donations, and we were absolutely overwhelmed by support from communities and from business, and also from other local restaurants within Nottingham City, who were themselves part of an initiative called Open Kitchen, to use their skills and their facilities to create meals for both the NHS and for vulnerable people. And we started slowly. We'd never run a Meals on Wheels service before, but as of tomorrow, 20,000 meals will have gone out to our service users, both in our supported accommodation, but also in the community. We've sent out in excess of, I think, about 900 food parcels, thousands of care packages for people in terms of toiletries and products for babies and nursing mothers, products to our families. We sent an Easter egg to all the children across the whole of Framework. So we've done some really quite amazing things over the period of the pandemic, and we did it very quickly. We distributed the alcohol that Andrew talked about, and managed to get hold of 300 burner phones, which was much harder than it sounds. Again, which we redistributed both to services, but also to people who were self-isolating in the community. So it was a hugely joined up effort. Fundraising, Andy, who's hosting the event this evening, was very involved with his team in helping us communicate with those who wanted to help, whether it was, sort of personal donations, like say company donations, or butchers who suddenly found they had a huge amount of meat on their hands and wanted it to go to good use. So we sort of had a fantastic response, and a huge number of people have worked tirelessly really over the last 4-5 months. We're winding it down now. Now that we're sort of coming out of lockdown, but we've really learned how adaptable we can be, how quickly we can respond to quite, sort of dire needs of people who are really very frightened and very isolated in the community. So that was a fantastic, I think, response. And in the end, we had 25 volunteers working alongside us. And like I say, we're keeping in touch with everybody who we weren't able to offer opportunities to, because they might want to help us in the future. But that's roughly sort of what we did in the volunteer response team.
Thanks, Claire. That's a great effort you've described there. Just move on to another question that we've had. As Andrew mentioned, the Everyone In initiative.
Mm-hmm.
Can you tell us a little bit more about that?
Okay. As part of the response from central government, Louise Casey, who was appointed really as the, if you like, czar of rough sleeping quite a long time ago, decided, and it was a really fantastic initiative, that everybody who was living rough on the streets of Great Britain would be offered accommodation, would be taken into generally hotels that were no longer being used by tourists coming to cities, because everybody had been asked to stay home. So in Nottingham City, just as an example, 86 people were rehoused under Everyone In. And Framework delivers the street outreach service in Nottingham City. And so we were a big part of the effort. We knew the people who were sleeping rough. We knew how to contact them. We knew where they were. They trusted us. So there were 2 locations, Rooms and the Mercure Hotel. Some of you might have seen the report on East Midlands last night, that was talking about that initiative, and then sort of what's happened subsequently. Those individuals were supported, like I say, by Framework staff, and both in terms of food, in terms of support, in terms of other kind of mental health related support, substance misuse. Some of our people from Nottingham Recovery Network went and visited people in the hotel if they had issues around substances or alcohol. So that, and then our staff have worked with each of those individuals on a resettlement plan, because part of the programme was to look at, you're taking everyone in, but then what's going to happen with those people after the pandemic has, sort of had its first wave, I suppose, and once the measures of lockdown started to be relaxed. So Framework has rehoused about 46 of those individuals in various of its accommodation across Nottingham City. The local authorities rehoused people into tenancies. Some people had no recourse to public funds, and it's taken rather longer to rehouse those people, but the government did extend Everyone In for a further 12 weeks to help those individuals complete the correct paperwork so they could then find work and find settled accommodation. You might also have seen on the news yesterday that very sadly, the numbers of rough sleepers are now rising again. The Everyone initiative has finished, but I think the government is committed to trying to find a solution for this new and emerging group of people who are finding themselves rough sleeping. I think we've all been aware that the numbers of unemployed people is rising drastically, very, very quickly. And you know, sort of people are losing their homes as a result of losing their incomes, and they're finding that they're sleeping rough for the very first time. And our street outreach teams are working, I think, with in Sheffield, in Nottinghamshire and in Nottingham City with that emerging population. And our key aim really is to support those people off the streets as quickly as possible, so that we can limit the sort of damage that lifestyle does to people's health and their mental health. So we have put in a bid to Crisis, who had a grant fund. We haven't heard about it yet, but we applied for £100,000 to try and sort of secure additional resources so that we could house people who were newly rough sleeping for a period of 3 months, while we also worked with them to try and get them employment, so that we could, you know, sort of get people out of what is sometimes quite a negative cycle of homelessness, and sort of move them back into independence and employment and sort of social inclusion as quickly as possible.
Thanks, Claire.
Okay.
A couple of really great examples there of the great things that can happen when people come together with a common aim.
Yeah.
We've had a few questions actually on how the pandemic has impacted young people. Can you elaborate on that?
Yeah, I think we've been trying to sort of capture some of the feedback from our services. Framework works with young people who've left care settings. Quite specifically in Nottinghamshire, we work with teenage parents. We work with young people across Nottingham City who find themselves homeless. I think what we found during the pandemic, we've had to open 2 brand new projects that we've had to get off the ground really quickly. One over at Home Pierpoint and one at Brackenhurst, actually, part of Nottingham Trent campus. And that was as a result of young people being asked to leave home by their parents during the pandemic. Or perhaps they'd been sofa surfing, because as you realise, you know, sort of everybody was told that they needed to be within their own households, and if you were relying on somebody else for your accommodation, perhaps they might have asked you to leave. So we've had, like I say, to open 2 brand new projects in the space of a couple of months, and we've recruited staff. Some of you might have seen that we've had many sort of recruitment campaigns over the pandemic. We've been, you know, having Zoom interviews with people and then moving new staff across our services to try and fill a lot of the gaps. I think one of the things, the feedback that we've had is that I think it's been really challenging for young people. It feels, I don't think people follow the news. Young people perhaps follow the news in the same way as a lot of older people. They get their news in different ways, or they don't perhaps watch the TV in the same way we do. They might, you know, sort of get things through social media or through YouTube. My son is 18. He falls into that group of kids who've got their A-level results today. And it's been a very challenging time, I think, for young people. They have been unclear about what's happened. They don't receive the messages in the same way. I think the effect on people's mental health has been really significant. I think people have felt quite lost. They've been unable to socialise. They've perhaps been able to see family. And it's been very isolating. And I think sometimes that has presented a lot of challenges for the staff. I think we have had some difficult situations to deal with, because I think also it's been difficult to explain the concept of self-isolating and or social distancing to people that perhaps also every one of us has probably been sort of 18 who's in the audience at the moment, and you feel quite invincible when you are that age, and you feel like nothing is going to affect you in, you know, sort of, or affect your health. And so perhaps you don't take things as seriously as other people might. And so it's been quite difficult to manage the messages, manage social distancing within those settings. And I think that we are very concerned as an organisation that we move very quickly, I think, and quite rapidly and almost quite assertively to make sure that this group of young people that we work with don't find themselves in a sort of an abyss where they have very limited options and a very sort of a shrinking future in terms of apprenticeships, training, employment, future housing. So we're very concerned about that group of people. I think, you know, sort of looking at the research that's been done, it's now sort of been established that the biggest impact of COVID-19 has been on young people. And that's, as you know, your kids as young as 6. We house families, we house babies, we house teenagers, and we house young people across all of our services, across the whole of the East Midlands. So I think, yeah, we need to be really mindful and really focus on their futures.
Thank you, Claire. It has been an extraordinary year, hasn't it?
Yes.
I'd like to speak with you now briefly, actually, about some of our plans for the year ahead. Next year is a very big year for Framework, because we're going to be celebrating Framework's 20th anniversary throughout 2021. As you might have expected, we've had to cancel all of our events this year, and we're trying some new ones in their place. And so what we're aiming to do is hold some events in the spring, all being well, including our big sleep out, which is usually in November, and our Easter service at Southwellminster, which we hope can go ahead in some format. Before all of that, though, please do look out for the launch of our winter fundraising appeal, launching on or around World Homeless Day on the 10th of October. So I'd like to say thank you to all of you for joining us today. Thank you, Claire. Thank you, Devon, for making it go so smoothly, and Chris for your support, and to all of you for continuing to support our work with homeless and vulnerable people, and we will see you again soon.
Bye. Bye. Thank you for joining.